Welcome to Pharma. Opioids mechanism of actions. Example of synthetic opioids include morphine, oxycodone, pethidine, methadone, tramadol, fentanyl, and a couple of others. All opioids mimic the effect of the endogenous opioid peptides like endorphin and dynorphin. Opioid receptors are G protein coupled receptors. They are classified into three main types mu, kappa, and delta receptors. They are widely distributed throughout the central nervous system and peripheral nervous system. Before we talk about opioid mechanism of action, let's just get a brief understanding of the normal electrical activity of the neurons. Glutamate is an example of an excitatory neurotransmitters. In case of pain, glutamate and substance B are the main neurotransmitters that are associated with the sensation of pain. Both produce excitatory effect by causing depolarization, which in turn responsible for the transmission of electrical impulses. On the other hand, GABA is an inhibitory neurotransmitter that block or suppress the neural activity by causing neuronal hyperpolarization that occur when the membrane potential become more electronegative below the resting potential. Opioids act in presynaptic and postsynaptic nerve terminals. Once opioid drug binds to mu-opioid receptors in the presynaptic nerve terminal, they inhibit a neurotransmitter's release. If the excitatory neurotransmitters like noradrenaline, acetylcholine, substance B, and glutamate get inhibited, this will suppress neuronal firing, leading to inhibitory action. This is the mechanism of opioid mediated side effects and pain relief. In terms of GABA, GABA is connected to dopaminergic neurons and reward system. Normally, GABA inhibits or regulates dopamine release. Once GABA release is inhibited in reward system, this will cause excitatory action by increasing the release of dopamine. This is thought to be the mechanism of opioids mediated euphoric effect, and that will lead to dependence and addiction. The inhibition of neurotransmitter release can occur directly or indirectly. The direct inhibition of neurotransmitter release from presynaptic nerve terminal occurs by inhibiting both calcium entry in the cell and adenylate cyclase, which in turn reducing the level of cyclic AMP. The indirect effect occur by increasing potassium efflux and thereby increasing hyperpolarization, which in turn inhibits neuronal firing. The postsynaptic effect of opioids involve only inhibitory action, which is mainly resulted by increasing potassium efflux and thereby increasing hyperpolarization. Also inhibits both calcium entry in the cell and adenylate cyclase. The end point of all of that is to reduce the transmission of nociceptive impulses.